Spinal cord lesions. Spinal muscular atrophy. Degeneration of anterior horn motor neurons causes symmetric lower motor neuron lesions. Flaccid paralysis. Spinal cord lesions. Spinal muscular atrophy. Degeneration of anterior horn motor neurons causes symmetric lower motor neuron lesions. Flaccid paralysis, hypotonia, and fasciculations. Presents as a floppy baby. Mutation in SMN1, autosomal recessive, known as autosomal Reverdnick-Hoffman disease. Amyotrophic lateral sclerosis. Combined upper and lower motor neuron degeneration with no sensory loss. Upper motor neuron signs, spasticity, clonus, Babinski. Lower motor neuron signs, fasciculations, atrophy, weakness. Often due to SOD1 mutation. Fatal. Treat with riluzole. Anterior spinal artery occlusion. Spares dorsal columns and Lissauer tract. Causes bilateral motor paralysis below lesion, corticospinal, LMN weakness at lesion, anterior horn, and loss of pain and temperature below lesion, spinothalamic. Dorsal columns intact. Tabes dorsalis. Seen in tertiary syphilis. Demyelination of dorsal columns and roots. Loss of proprioception and vibration sense, ataxia, and absent reflexes. Associated with Argyll-Robertson pupils and Charcot joints. Syringomelia. Cystic cavity expands the central canal, damaging anterior white commissure, bilateral loss of pain and temperature in a cape-like distribution, with preserved touch and position sense. Often with Chiari-1 malformation. Vitamin B12 deficiency. Causes subacute, combined degeneration of dorsal columns, corticospinal tracts, and spinocerebellar tracts, ataxic gait, paresthesias, and loss of position vibration sense. Cauda equina syndrome. Compression of L2 and below, asymmetric radicular pain, saddle anesthesia, loss of bladder, bowel control, and absent knee ankle reflexes. Treat with emergent surgery and steroids. Poliomyelitis. Poliovirus infects anterior horn motor neurons, LMN paralysis with asymmetric weakness, fasciculations, and atrophy. CSF shows lymphocytic pleocytosis and mild protein elevation. Poliovirus. Brown-Sequard syndrome. Hemisection of spinal cord causes. Ipsilateral LMN paralysis at lesion. Ipsilateral UMN signs below lesion. Ipsilateral loss of proprioception, vibration, touch below lesion. Contralateral loss of pain and temperature below lesion. If above T1, adds ipsilateral Horner syndrome.